So today we've seen 4 cases, different ages and stages of life, that for want of having biofunctional adjustments using monitors, posture, where we're dealing with the tongue and its relationship with the hard and soft structures in the mouth. If the tongue has too much space, it feels lost and it activates the autonomic nervous system. It also activates it if it doesn't have enough room and can't come in. For the most part, you'll see a 30-gallon tongue in a 10-gallon bucket, but there's a lot of where they've been overexpanded or extractions. They have too much space. So too much water or too little water, they all can be a problem. But we like to see what the tongue is doing, and the way we do that, this is the take home for today. You can do this with any dentistry, partials, dentures. I know that a lot of you use pressure indicator paste. I get it from Henry Schein. I buy it in these large jars. And we put it on instead of the tissue bearing surface to check for sore spots, which we should, but after that we paint this on with a brush, a Q-tip, or a gloved finger. I just reach in, scoop it, and paint it all over there. It has to be, whatever you're pipping has to be perfectly dry or it will not adhere. You wish you'd never seen this stuff then, because you got to get it off, you got to get it dry, and you got to start all over. So these little dapping dishes are what they call paper portion cups. Genpack makes them. One of the assistants will dispense this out of the larger container into little cups and give us a portion and put a paper towel over it so he can stack them. So basically we use the tongue blade to dispense it, and either a gloved finger and paint the brush strokes all in one way, or the finger strokes, so that when the tongue comes in you can see the pip move on the outside of the appliance or the partial or the denture. Many times you'll be having trouble with the denture. They just don't like it. They're not happy with it, and now you've got all the sore spots taken care of, but there's something wrong. If you will pip the outside, it's amazing what you'll see as far as the thickness of the acrylic blocking it or causing a problem with the trajectory of the tongue coming into the mouth. They also sell PIP in these little packets which has a PIP remover in it, a liquid. This is a brush and one portion of PIP. I use so much that this would not really satisfy the office needs, but if you have a patient and is coming from a distance, or is handy with a Dremel tool, you can show them how to pip their appliance if they're having a little sore spot or feel like they may be blocking again, and let them whittle away. Depends on the patient. There's some people I would never do that to. We also found that the PIP is also a lubricant, but it also, where there is a catch, the tissue seems to catch it sometimes, and you've made adjustments, but you want to give the patient something to check it with, and also to kind of add that lubrication is you put a little packet, send it home, and they can put it on the appliance, and many times that will get them till what was catching has been relieved. The big thing that we want is that for most of us, we were taught to put it in, check there aren't any sore spots in the bite especially, and then the lateral excursions, and we're done. Well, a functional adjustment says, how does this body like what we just did? And that could be through the monitoring using an EKG or pulse ox and something that shows the number of beats per minute, doing a blood pressure. So you really have to get a baseline to know how your work is affecting their baseline. And so I try to encourage my patients that after we're finished, continue to check the blood pressure at specific times, 1 in the morning and 1 in the evening, always about the same time, so that they can monitor their blood pressure. If they're on blood pressure medication and you put an appliance in, it's a good chance you may be affecting that to the positive or to the negative. You don't know. And so by having a starting blood pressure and monitoring the blood pressure, if the patient is normalizing, then you want them to work with the doctor and you and get the medications adjusted accordingly. As far as the use of biofunctional dentistry, we do it every day, whether we monitor it or not. There is a impact on the body. For every action there's a reaction, and in this sense we've never really studied the effect dentistry has on the tongue or breathing or swallowing or speaking. We can now. So I'd like you to have this just take home with the PIP paste and checking how that function is. That's another method of monitoring what you're doing. You're not getting the vitals, but you are seeing the trajectory. It'll be amazing how sometimes the tongue is affected by the contours on a denture or a partial. I've even made partials and dentures with contours so they can get the tongue in the right position. And a lot of times we'll do that on their spare or a duplicate, so that we won't be affecting their permanent denture and cause problems if we have to keep changing it. So I usually take their denture that they're not particularly happy with, and we try to do a duplicate denture that they're satisfied with, and eventually transpose that information back on the original denture that we all were afraid to touch until we got this thing squared away. Okay, that's it.